So one of the really useful things when you're preparing for the CSA is to join a study group early. Now I want to talk a little bit about some tips to help you make the most out of your study group experience. So the first thing is a good number to meet on any given day is 3. One to be the doctor, one to be the patient, and one to sort of observe, be the examiner, both to put that pressure on and simulate the real exam, but also it's much easier for someone who's observing from the outside to be able to give useful, relevant feedback. The person who's being the patient, they're busy thinking about the role, thinking about the cues and what they've got to say, which symptoms. It's not always easy for them to also give feedback. So 3 is good on any given day. And again, to make the most out of it, it's important that you all agree that you're going to give constructive, critical feedback, because sometimes there is a risk that everyone just wants to be so nice, everyone's so shy to say anything that could in any way be seen as being critical, that they end up just talking about the things that have gone well. And if you know all the things that you're doing well without someone pointing out the things that you've missed or the things that you need to improve on, you don't get better, and you could go in with a false sense of security. So it's really important that you all agree that, look, you're going to talk about some of the things that went well, but also you need to discuss the things that could have been done better, the things that were missed, the important things that would be important for things like safety. And also that you make sure for each case that you don't just focus on communication. Of course, being a good communicator is important, but it's only 1/3 of the marks in any given case. The other 2/3 are about history, examination, diagnosis, management. So it's important that you discuss all 3 domains, so the data gathering, the clinical management, and the interpersonal and communication skills in every case. Because sometimes, someone might be fine with the communication, but then lose marks because they forgot to exclude some really important red flags, or that because they ran out of time and they weren't able to get through their consultation in time, they hadn't discussed follow-up or safety netting, and that could affect their management mark. In fact, management is the domain that candidates score worst on average, and it's the domain that usually contributes to those people that fail. One of the big contributors to them ending up failing, if we look at the data from 10 years worth of CSA cases that we've analysed. So it's important that you look at all 3 domains. Now, while 3 is a good number to meet on any given day, try to have a much bigger study group overall. So, there might be 5, 6 of you that are preparing for the exam at the same time, so that you can meet with different people on different days. This is useful because sometimes, if you get the same feedback from the same person several times in a row, you start sort of blanking out what they're saying. But sometimes they might also feel that I've mentioned that they've come across in a patronising way in the way they said that, or that their management seemed a bit doctor-centred, didn't really involve the patient. And I've said that to them 3 or 4 times. They're still doing it. So then they get fed up of saying it, and you sometimes think now, oh, I've got better at that. But actually, that's not the case. Whereas if you met with someone else and they also said, oh, actually, that came across a bit doctor-centred, and someone else said, that came across a bit doctor-centred, you might think, hang about, I really need to work on this. And then you might actively start looking at how can I present this in a more patient-centred way? How can I engage the patient more? It's also useful to meet with different people on different occasions, because you can take things from different people. You've all got different experiences. You might have a colleague who's done a lot of pediatrics, and the way they take that history from a child or from a young adult or a parent of a young child might be really slick just because of the experience they've got. They've done it hundreds of times. You might have another friend who's worked in obstetrics and gynecology for a long time before changing to GP, and the way they deal with menorrhagia or dysmenorrhea, you might pick up some really useful tips. It's also useful if you can meet with people from different backgrounds and maybe not always with your very close friends, because you can get different things from different experiences. Sometimes if you meet with people who've trained in a very similar environment to you, you might make the same mistakes and they won't pick it up because they are also familiar with that, or to them it might seem okay. Whereas when you get different perspectives from different people, you can take different bits of feedback, process it, and then what you can do is you can take also different things that other people do well and incorporate it into what feels natural to you, okay? So that overall, you start taking different bits, incorporate it with the really good things you're already doing, and you get a much better improvement overall. Next thing is that early on when you're studying in your study groups, it may be fine to just, have a couple of cases just to get going where you might not be doing it in strict exam conditions and you're just giving general feedback. As you get closer to the exam, try to practice to time. So 2 minutes to read the brief, exactly 10 minutes to do the case. At 10 minutes, stop, no matter how far they are, and mark as far as they've gone. And what you might see is this will give you an idea that, okay, you might know the management, but a lot of candidates, the reason they fail the management domain in a case is not that they don't have the knowledge, it's because they were taking so long in their history that they haven't got that skill of being focused and concise but still safe in their history, so that it means that when they get to management they've run out of time. Now, if you run out of time and you haven't got to management, you're automatically going to lose marks in that domain. So it's useful to get used to that pressure and recreate that environment. Okay, so finally, it might be worth videoing 1 or 2 sessions of your study session so that you can then watch it back with your group and discuss what went well, more importantly, what to improve. And there's some things that you're going to pick up when you watch yourself back on video, like body language, like the way that you might have missed a non-verbal cue because you're busy looking at your notes, or the fact that you seem obsessed with the time and you keep looking at your watch or your clock. These are some of the things that are quite useful to pick up, maybe observing a video once or twice. It does get tedious doing it for too long, but it's certainly worth doing for 1 or 2 consultations. So to summarize, join a study group early. Try to have a large group of colleagues that you're going to meet up with, but on any given day, 3 is a good number, so that you get lots of practice, but also that you've got that pressure of the exam. It's important that you all agree to give critical, constructive feedback, not just focus on the things that people are doing well, but you also need to discuss what's missing, what could be improved. Remember, every case has all 3 domains being marked, so do give feedback on the history, on the examination, on the red flags, on the diagnosis, management, follow-up, safety netting, as well as picking up cues, clear explanations, communication and interpersonal skills, being patient-centered, and so on. Okay, and then try to take from the experiences of others, and try to get as much practice as you can. Any skill, the more you practice, the more you're going to develop, the more you're going to benefit from it. And you can definitely use that group as a way to motivate each other, as well as to get lots of practice, and actively practice those topics that you are less comfortable or less confident in, so that what is a weakness will become a strength in the exam, that you're really confident in those things, and it will really help you. And the more you practice, the more you're going to improve. You're going to get through this, and you're going to smash this exam. All the best.